500 patients using AI to help them? Wow, what could go wrong? Healthcare's most costly and overlooked problems tend to be around patient compliance. That is such a huge issue right now going on in healthcare. Despite access to care, millions of patients fail to stick to treatment plans, driving up readmission rates and long-term costs. There are estimates that say patient noncompliance in the United States alone costs at least $100 billion annually, and likely 300 to 500 billion when considering other social economic impacts. So today's patients can absolutely move from apathy to automatic with these AI secrets that can really transform their lives. Look, are you ready to kind of go on this journey with me to help your patients transform their lives? Just say yes and yes, and let's continue. I would absolutely encourage you to watch this video to the very end, as we're going to dive into the secrets that we use over the past several months to really enhance patient care. What we're going to talk about today, we're going to have 3 areas we want to cover. First, we want you to show you how we thought about using artificial intelligence first. Next, we're going to talk about what we did specifically and the steps that we enacted to kind of help our patients long term. And then finally, we're going to ask you to think about why you really want to act now. This is the key. You can't hesitate. Why should you even listen to me? Well, my name is Theo Harvey, and I'm a serial entrepreneur who went from lowly employee to a CEO who runs a remote multi-million-dollar healthcare startup from his home. I raised over $1 million from venture capitalists and other investors, and I work with large organizations like Cisco Systems, AT&T, the Charles Barkley Organization, and Blue Cross Blue Shield. My mission is to help healthcare professionals prepare for the new normal in healthcare before it's too late. Let's get into this. AI is great, but using it out of the box is not wise in healthcare. Why is that? There are multiple things that can go wrong with it. One is a process called hallucination. This is where the artificial intelligence just makes up things, right? Just makes up steps, makes up ideas. And a lot of times you have to understand how it can get through that process without messing up. And healthcare is so important that you have to be clear, because if you're not clear and getting a process started or any type of operations, people could get hurt seriously. Here's a fun fact. You can see this in action next time you do a prompt on ChatGPT. After you get your answer, put in this exact phrase: "Can you please check your answer?" I can tell you right now, you will be amazed about what it comes back with. I've done that multiple times before. So check that out. Let me know if that works for you. This is a quote by Sam Altman, CEO of OpenAI. He said, "The thing that I try to caution people the most is what we call the hallucinations problem. Model will confidently state things as if they were facts that are entirely made up." So you want to be careful about that. So I would recommend not using artificial intelligence or AI for use for clinical decision making or diagnoses. But we do want to utilize it to encourage patients to take their medications, remember their appointments, or general engagement with doctor instruction. It tends to work great that way. Matter of fact, there was a study, a 2024 study in the journal Healthcare, that tested an AI-driven appointment scheduling system, which predicts no-shows and automatically reallocates resources to open slots. Implementing the AI system raised the proportion of patients who actually attended their scheduled appointments by 10 percentage points per month and boosted clinic capacity utilization by 6 points. You can change behavior with personalized AI messaging, in our opinion, based on the studies, but also on what we've thought about using AI. So that's kind of what we thought about. We weren't looking at artificial intelligence to change diagnoses or to help with patient awareness. Really, it was about getting patients to change their behavior so they can make appointments, get their medications done, things like that, because that's the key. We think is really changing behavior, because healthcare is really self-managed a lot of times, right? Patients just don't listen to what the doctor says to do those preventative things that we all know that they need to do. That's kind of how we thought about it first, right? I can remember a time when we struggled to get patients to use their blood pressure devices, right, with our solution. We saw what was happening was that they would kind of get lost and not use it, and then after time they would just drop out of our remote blood pressure monitoring program. This is key, right? They had to stay on that program in order for the practices to understand how to best help the patients. If they were chronic kidney disease patients, you can slow down the progression of CKD with patients who are taking their blood pressure, understanding what's going on with their blood pressure over time by having controlled hypertensive or understanding what's going on with their blood pressure, patients can slow the progression of this disease state, chronic kidney disease. And so what was happening was these patients weren't doing it, right? We were struggling with it over and over again. It wasn't until we kind of thought about like, how can we kind of engage them, right, to do it more? And so we did some simple tweaks. What was the best time for the patients to take the blood pressure readings? What are areas that encourage them to want to take it? Let's say they have a wedding for their daughter or son that they want to attend and not be sick and not feeling worse. What are some goals that they have for them lives? Just really understanding, what was motivating them, the why, when they were taking the blood pressure reading, how were they taking it? Were they taking it standing up? Where they just had a sugary meal. So once we kind of understand the who, what, why, where, when, then we're able to kind of use artificial intelligence to make it personalized, right? To understand exactly when's the best time to remind them to take a reading, right? Based on what they were doing already. Reminders of the why they were going to do this, right? And that really changed the case for these patients, right? This is a good point. When your back is up against the wall, you have to try something. So let me say this. When your back is up against the wall, you have to try something when it comes to patients. And that's what we did. I want you to do this one quick action to get a quick win. Find what areas where your patients need a little extra nudge in, like maybe medication, right? And figure that out. Maybe it's appointments, maybe it's general doctor recommendations, but find that one area that your patients need help in so you can center on that problem and get to work. So what did we do to implement our artificial intelligence program, right, for over 500 patients? Well, first, we made it multicultural, right? So that the AI can speak in the patient's native language to actually build trust. So why is that important? Well, there's a statistic that said in 2023, a study of 176 limited English proficient, basically they spoke Spanish, adults, found that seeing a language coordinate physician produced a 7 percentage point increase in the patient's reported trust. We had to make sure that whatever patient we're talking to, whether they speak Spanish, Hindi, Mandarin, Cantonese, we wanted to make sure the text reminders or the AI reminder configuration we were building was being able to speak in their native tongue so that the patient felt a kinship to it, right? That's so important. That was just based on studies and data that we saw. Next, we made sure it tied it to a response to a previous action or non-action. So in this case, we tied it to make sure that the patient was already doing a blood pressure reading, right, or not. This is so key because if we didn't have that awareness of what the patient was already doing, it allowed our system to be more accurate in making sure, that just in time kind of reaction to the patient. Finally, we personalized artificial intelligence based on non-patient identifiable information. This is important, right? Because like we talked about before, if you want to lower patients' blood pressure reading, there had to be a why to that, right? For some patients, it was being able to walk again or spend time with their son and daughter, playing sports. But because they were always sick all the time, they couldn't do it. So making that why so personalized and infusing that with the text messages we sent out really helped increase the patient's compliance, right? We were actually seeing patients who were using the device at all using the device every day at the end of this trial period that we started. We went from roughly about 40% compliance to nearly 95% compliance when the patients were being sent these personalized text messages using AI in their own language, also based on their actions, and then also personalized. This is so key. There's a quote from McKinsey & Company, a large consultancy firm, that says data analysis as well as disciplined framework for thinking through options provide a helpful structure for making the decision. In my mind, a disciplined framework is simply a fancy way of saying to have a consistent thought process on how you're going to do anything. Very similar to workflows in healthcare, right? Applying the thought process, the frame I just spoke about, and applying AI technology to your environment and to your organization. One simple way to implement this is really, we have an opportunity. If you're interested, if you simply click below, you can schedule time with one of our experts to see how we can coach your medical practice in strategies that we use and we've been practicing for about a year or so now that really help implementing new technologies that can help guide you to success. In 15 minutes, we can guide you on this thought process, and that really puts you on the right path if this is something you want to do. So just click below and check that out. It can be daunting, absolutely, to get started, but you know what? The cost of inaction can be worse. Elon Musk, CEO of Tesla, has said, if your competitor is rushing to build AI and you're not, they will crush you. that is a strong quote. But I would say this, healthcare is definitely not a winner take all market like what Elon is faced with. But he is correct in that patients will leave your healthcare organization for another one if they're not getting better care. Right now, the better care can happen with augmented by artificial intelligence. One of the things that we're seeing is I can just remember a time when we first started developing our solution set in the healthcare space. We first developed with an app that prevented what they call COPD readmissions, basically patients who have respiratory issues and difficulty breathing. So this is so important because in readmissions, what happens if a patient goes to the hospital and is discharged from the hospital, goes home, and then gets readmitted within 30 days, that is a huge penalty for healthcare systems. Matter of fact, this is such a big problem that healthcare systems are trying to avoid that. That includes hospitals, clinics. Reason why that's important, because if they get charged for these penalties, that means they have lower margins and they just won't be sustainable, especially in the rural health area, right? This is a huge problem. So in rural Georgia, we were working with a large healthcare organization to kind of help prevent these COPD readmissions. And the way we did that was we figured, hey, what if we can just implement something that was already out there? In this case, it was called COPD assessment test, or CAT. And patients, they just need a simple app to just remind them if they were having what they call an exacerbation, difficulty breathing, to remind them to take their inhaler. So with this simple app and technology implementing, we were able to reduce readmissions by 25%. This is huge because not only that, it saved tons of time, but also the patients who got in the habit of using the inhaler more and ultimately got better over time. I would tell you this, small digital technologies can have a big impact on patients' lives. Let me say that again. Small digital technologies can have a big impact on patients' lives. To get started, commit today to explore how AI technology can improve the lives of your patients. Don't hesitate, because their lives are so important. You have to move faster in this process. So if you commit to it, then go ahead and make that first step that we talked about previously to move forward and get your patients ongoing. I think I kind of covered everything today of how you can kind of think about how we implemented artificial intelligence in our healthcare organization, how you can do it as well. Started with thinking about the process and how you can use AI in your healthcare organization. Second, we talked about exactly what we did, right? With blood pressure monitoring and understanding compliance and getting patients to use the devices more to prevent and slow down disease states and prevent hospital readmissions. But also we talked about fast action. Do that first step now, because if you don't act now, it could be detrimental to your patients. And if you like this video, click on the next one that we can provide additional impact for your healthcare organization as we look to transform healthcare to the new normal.